Rất ngưỡng mộ cái tài IT của bác sĩ Tú.
Dạ, cảm ơn cô.
Dạ, phức tạp lắm á.
Đó cô share chưa?
Video, bây giờ cô vô video rồi, thấy rồi.
Các bạn, video.
Ok, so share.
Dạ. Cô share rồi phải không cô?
Dạ.
Okay. Welcome to our show, Live a Long, Healthy Life. Today is the 31st of August, 2018, Friday again. It seems like so quick. My name is Dr. Tran. I'm a gastroenterologist.
I'm Dr. Teneese Nguyen. I'm an internist who specializes in geriatric as well as hospice and palliative care medicine.
Yeah, today is a special day because we are talking about the most common, the most favorite topic that I've seen so far, and it's happening all around the world. And this is a topic that I waited for a while. However, we had a special guest with me, and I have seen her Facebook live a lot. And once I heard that she has prepared topics on this topic, which is gout, I had to get her on our show, and I was very glad that she accepted my my invite, and then she will be here to share with you about the important about the topic gout. Okay, and again, why don't we just introduce her?
Yes, before we have her on connecting to share with all of us, I just wanted to introduce to every one of us a little bit about her background. She's actually a lab scientist, more so in the medical field. She has been working 30 plus years at Johns Hopkins Medical School, also at George Washington Medical School as well. And later, after that, she has been working at the Quest Diagnostic Lab. I know for many years been working, she decided that her time is not focusing into the disease itself to treat the disease, but now she's changing, switching gear to preventive medicine, more of like preventive disease. It's what we are interested in as well. It's better to prevent having disease than having to deal with the disease than having to go through treatment. Obviously, treatment require, extensive work. On top of that, it's pain, suffering, as well as side effects come along with it. So with very little time, I would like to introduce to us our scientist, Hannah Tran. She has a Vietnamese name, but then we'll just call her Hannah. So
hello. Yeah.
Hi. Can
hello,
you hear us, Go?
Yes.
Yes.
We're very glad that you are here on our show. Can you say a little bit background for our guests to hear?
Yes. Good evening, everyone, and Dr. Teneese, Dr. Kim, very to be up here to share what I learned about gout with the two favorite doctor of mine. I've been watching, follow their site and listen a lot and study and learn a lot from them also what their background as a doctor in medicine. So it's an honor to be here with them tonight. But I am a medical lab scientist, 32 years, and I have been medical manager and director for the Johns Hopkins Medical School in Maryland and George Washington Medical School in DC, and also Quest Diagnostic in Baltimore, in Maryland area too, Rockville. But I decided to join the Nu Skin, Pharma Nu Skin since 2013 because I am rather into prevention than in diagnostic medicine, was my background. So I'm into prevention right now. That's why my reason for leaving my field. And even so, with the medical lab science background, it helped me tremendously to know how to apply the natural botanical based and pharmaceutical graded supplement from pharma mechanism into prevention of disease and cancer. So that's the way about my passion for skin pharma mechanism.
No, that was very great. Thank you. Thank you. As you can see, he came from a good background, talking about the pharmaceutical. He researched on a lot of things. And one of the things that research on is about this gout, and which he's going to share a little bit later. If anybody doesn't know what gout is, I mean, in our body, there are more than 100 kind of arthritis. And gout tend to be one of them. And this is the one that we know specifically the reason what cause the gout, and this is all deal with uric acid. And then obviously the uric acid, 10% of the people who produce more uric acid in the body, and 90% of the people who does not excrete out or take out the uric acid in our body. And so because of the accumulation of the uric acid in our system, that's why it start giving us trouble. That's why it is giving us problem in terms of pain and all that. But an overall information is that, in America alone, there are more than 6 million people has this disease, this gout. And if you're talking about worldwide, I'm talking about billions of people who are involved, who has this problem. And apparently India and China are the top 2 countries that, their people tend to have gout. And we will talk about, the cause and all that stuff. But most of the time we see gout is, mostly seen in men. And because the uric acid is being produced more or is high after puberty, that's why you tend to see more in men after puberty around 30 years old, 35. For female, you do see them too, but usually you see the uric acid elevated after their menopause. And so you see women tend to have gout at the later age compared to men. Okay, and because of that, that's why we have to be careful. There are 2 different genders, 2 different time, and so just have to be watching for that. Now, in terms of the cause, what caused the gout, I'll leave it to our scientist Hannah Tran to explain that to you, since he has a whole much deal of all the information, and I love to hear that. Yeah, go.
Well, thank you, Dr. Tu and Dr. Teneese. Yeah, the reason, the cause of the gout, very simple. That's because it's the way we eat and the lifestyle. Let's just say that. Of course, genetically speaking, it contributes some of it, but that's a very small percentage of people that have gout is due to the genetic condition. Even if your parent, 1 or 2, both of your parents have gout, but if you grow up in the family that they don't feed you with a lot of sugar, then when you grow up into an adulthood, you don't have gout. Okay, so it has a lot to do with eating or what you put inside your body. So the reason a person has gout, because it's the result of many years that the concentration of acid uric in your blood increase. And it go unnoticed because the majority of people out there, we have higher than normal uric acid in our blood, but we don't know because we don't. It has no symptom to let us know unless we accidentally find out after a visit to a doctor office for the normal checkup. Okay, so normally because of that we don't know. So uric acid in the blood go through the kidney and then it just stay in the blood, and your body keep producing uric acid due to what you put in your mouth, what you eat on your daily lifestyle, and then the kidney cannot filter it fast enough, so the uric acid stay inside your body and go to the joint, and it turn into the crystal, and the crystal deposit around the joint and tissue and create inflammation, and therefore the pain come along with it. So that's the reason for gout. But also other disease that also increase your risk of having gout, and those are diabetes, high cholesterol, high blood pressure, and kidney if you have kidney problem, and also heart problem although 5 different types of disease also contribute to the reason why you have gout. Yeah, and okay, and the thing is, according to Dr. Joseph Mokola, and so some of the thing I read on PubMed.gov, the more sophisticated, advanced the country, the more popular is the gout problem.
Mm.
So, Dr. Tu, you agree with that? Yeah. So because all the product are change all the GMO out there and so on, and we put too much preservative into our food. We don't eat natural stuff anymore. So that's why we have gout. There are 2 different things that contribute mainly to why we have gout. And the first one is high fructose corn syrup. Okay, so that's the main thing, because it's everywhere out there with people. It's everywhere, because even so, we say that a lot of the majority of time we think that we have gout because we eat things that have too much purine, like meat, organ meat, or a lot of fish, fish that have a shell on them, or some kind of mushroom. But though just some of them, but the major thing that affect why the attack of the gout and why we have gout, and it becomes serious and it becomes more popular because of the high fructose corn syrup. Yeah, and it's a lot out there, and it's in your soda or your drink. Or the majority of drink, you look for the label and look for high fructose corn syrup. That's the thing that develops gout in your body. Right, Dr. Tu? And yes. Then also, not only that, not beside the high fructose corn syrup, also the natural sugar in things like apple and even orange, called fructose, Fructose. Though fructose sugar in fruit, the majority of fruit, also if we ate too much fruit, it also the fructose in the natural fruit will create gout for us. Yeah. So therefore, the major thing is fructose syrup and fructose from fruit. That's what the reason. But beside that, a lot of research lately also pointed out that the obese or overweight also cause that. Yeah, because and go back to the fructose. Why fructose is the problem? Because fructose is not doesn't contain enzyme that our body needs, doesn't contain the vitamin that our body needs, and doesn't contain mineral or even antioxidant. Okay, so it's really what it does. It just interfere with your body to utilize all those important nutrition for our system, and also it interfere with for example, with your heart, to utilize the magnesium and chromium effectively to keep the heart healthy, for example. So the main thing is we have to, if you already know that you have high uric acid, so the main thing is stay away all those sweets out there, and all those sweet drink or cookie or cake or whatever sweets, stay away from it. And then some of the scientists also point out that the chemist, PhD, his name is Russ, IUSS, and Bianchi, and he also point out that a lot of hidden fructose in our daily food. So be aware of those things like inulin, like INULIN, and isoglucose, anything had to do with glucose or fructose syrup, or Dahlia, DAHLIA, read the label, please. And syrup tapioca, and tapioca syrup, glucose syrup, corn syrup, CORN syrup. I see it everywhere, mostly out there on the market. And then fructose, anything had to do with fructose crystal and glucose crystal. Or even lately, we see a lot of agave, like AGAVE, agave, they say it's natural, and no, that is fraud. That is not true. So stay away from those label, those things that you saw on the label. So anything had to do with high fructose corn syrup and fructose and glucose and agave, we stay away. So that's what Dr. Russ Bianchi warning us. Yeah. So he said that also all the research saying that why it's all over the market out there, because it's sweeter than sugar and it's cheaper and it's addictive. So when we get on it, we become addicted, and we feel like at a certain time we have to go out there and buy more sugar drink and cookie or whatever to consume. Yeah, and then even for preservation of the food or on the shelf, they make the fructose syrup and with the salt, it keep the product on the shelf like cookie or cake or whatever stay longer without being spoiled. So that's why it's being all over the place. So yeah, and
that's why it's going to be a very difficult. It's going to be very difficult because everything that we eat, everything is on the on a shelf on the counters are all made of fructose, and so you can't seem to stay away from it. That's why the prevalence of gout is getting more and more each year. That's why every country is getting, this numbers of gout disease in their populations more and more every year.
Yeah, and I think right now, to my estimation, about 95% or more, or maybe 98% of stuff out there on the shelf have fructose,
right?
High fructose corn syrup or glucose or whatever in that format. And so now the second reason, the first reason is the low sugar, and then the second one is the overweight. Even you slightly overweight or obese is the worst, right? So the reason for your gout is because you overweight, because the fat that the visceral fat, even the visceral fat in your body, it's a risk for having gout. Okay, so that's why we had to try to not allow that happen, because a lot of medical facts prove that the disease like heart disease and diabetes and high blood pressure and even high triglyceride will be the result of the gout that we got. So it goes along with gout. Let's just say that. That's why we had don't ignore if we have a little bit tummy in, on our body. Don't ignore that, because it's indirect.
There are also other risk factors as well. For example, drinking alcohol is another, especially beer. Yeah, that will give an increased risk of gout as well.
Also, eating red meat, pork, and beef, as well as eating the internal organs of the beef or the pork, as well as shellfish product, or using the oily fish, also causing that as well. But a lot of the time, most people don't realize that these are the common stuff that they eat or consume in. So from what our scientists saying here, my personal preference or recommendation from what I see is try not to eat processed food, because anything processed is not healthy for us, and it has a lot of sugar, fructose, and corn
to
preserve in there as well. So and try to eat organic food as much as you can, and greens, fish, or chickens, any white meat. It's healthier than red meat in general.
Other things also, certain medication can also give you that increased risk of uric acid. Chemotherapy is one of them. Some allopurinol, which is ironic, some of that, nicotinic acid, some chlorothiazide for high blood pressure. And so
and aspirin, a baby dose aspirin can cause it too, and also levodopa given for Parkinson can cause that, and cyclosporin given for people who receive transplant can cause an increase in uric acid as well.
But obviously, not everybody who take this medication tend to have gout. It's a matter of whether or not the uric acid being excreted through the kidney, right or not. That's why number one is to be hydrated, so that you can flush out the uric acid out. But if you take all this medication, you dehydrated and all that, so your risk is a little bit higher. And so even though medication does tend to give an increase of uric acid like that, you have to be aware that what's the main purpose of your medication, just to help your high blood pressure, to bring down your cholesterol, et cetera, et cetera. But there's a small percentage that will increase risk of uric acid and obviously aggravate your gout. And so if that happens, then you need to talk to your doctor regarding about changing it. Because the uric acid, it's inside your system is too high, and so it starts to deposit everywhere, mostly on your joint, and that's why the first symptom that you have is joint pain, especially down on your great toe. It will swell up like crazy. It will be so painful that you cannot even walk. Even slight touch will cause problem. Otherwise, there are other places that the crystals will deposit as well.
Yes, the crystals also tend to accumulate in the back of the elbow, in the back of the earlobes, and also on the knee joint. But in this area, they don't tend to give people symptoms or pain. The most common one that induce or cause pain the most is the on the great toe, where most of us think of it as a bunion point area. That's when it affects most everybody.
Right.
But again, whoever experience or having the pain of the gout arthritis attack, it's very painful.
Yeah.
You can really walk, you can barely crawl if you have to have it.
Some people just feel that they just want to chop up that great toe.
Or amputate that leg
so that they don't have to feel that kind of pain. Yes. For initial presentation, you have usually one joint flare up, and then it'll go away within about 3 to 5 days. Usually it goes on its own. However, because during the time that you have the attack, the pain is so severe that you have to take something. And so doctors usually give you the anti-inflammatory, for example, Motrin, ibuprofen, anything that's non-steroidal. Sometimes they will inject the steroid directly into the joint to help reduce the inflammation, but usually it doesn't go away. The pain may stop temporarily, but you need to continue to take this such a high dose that you have to be very careful, because these medications do come with a side effect, obviously, and most of the side effects deal with your stomach, your GI tract. You have more discomfort, you have more pain, you have bloating, sometimes you have nausea, vomiting, and sometimes it created ulcers and bleeding ulcers, etc. And so during the time that you take these medications during the attack, we need you to be very careful, make sure that you eat first before you take it. And I know that you're going to need to take that in a high dose to suppress this pain, because it's very painful. You just have to be very careful, especially when you take it at night. So for those who have it and need to take these medications, is something that you have to be careful of the side effect. Other medications, once the attack is gone, obviously then some will continue with another medication to control the uric acid level, which is allopurinol. There's some other one as well. There are a whole bunch of them, but most common use are allopurinol.
That's for chronic gout.
Yeah,
for
chronic.
Acute gout, they use colchicine,
Yeah.
but it has side effects of having diarrhea and kidney failure. It could weaken the kidney.
Right.
Now, if the people who have the gout attack, and when there's a lot of crystal cannot be excreted through the kidney, it will eventually damage the kidney, and they will end up having kidney failure, requiring hemodialysis as well. I do see a few patients who's on dialysis. Just a point to say that a lot of different ethnic background tends to get gout more in Asian men, Indian men, also Samoan or Hawaiian men or Filipino men. They tend to get them more than than the Caucasian. The African American men, they don't get them as much, but the Black Americans, they tend to get them also.
So in terms of controlling the disease, I mean, if you have high uric acid, I think it's best for you to control it, to suppress it as much as you can and as long as you can, because now you may have initial presentation of the attack on one joint, The next time it may be either from the same one or it may jump to a different joint. And then the longer you have it, the many times attack that you have, and then a lot of your joint will get involved. And if the uric acid continue to be high and not well under control, then eventually it will damage your joint. And the deposition of this uric acid crystal all over the place, it will create abnormality to your joint. Some people even have to go through surgery to remove that typhoid. So it's very difficult, but it's very well needed to be controlled. And so if you have it, make sure that you are not one of those who have such a high uric acid in your system. Your doctors can, draw some blood and see whether or not if it's high or not. Okay.
But remember, during the acute gout attack, if they have the blood drawn to check for a level of uric acid, it will be inaccurate.
Yeah.
It will be a false reading. The best time they recommend to draw the blood is after the flare.
That's right. After.
Meaning the acute gout attack is gone, when it's resolving, no more pain, no more redness.
Yeah. Otherwise, they have to put a needle through that joint and aspirate it out to see whether or not
to see the crystal.
There you go.
Before I wanted to say to leave to our scientists to help us out about what natural products we could take. I just wanted to emphasize again that there are medication, but we do not encourage medication. The reason is because of the side effects of the bleeding, also the kidney failures, as well as the diarrhea as well, and dehydration. Combining from what all of us were saying, first thing is try to stay away from the products we're talking about earlier, and also try to be active, be healthy, exercise, lose weight, and make sure that you do not have or have no room in your body for any visceral fat or a belly, because that gives you risk not only for the gout, it gives you risk for a heart attack as well as a stroke, as well as kidney failing as well. Medication, like I said already, and surgery is not going to work. It's not going to solve the problem. The only way to prevent is to change your diet, change the way you eat, change the activities you do on a daily basis, and then we will leave it up. We will have a few minutes for our scientists here to talk about what Pharmanex have to offer for us if somebody has the gout attack, and if they would like to prefer the healthier or the alternative supplement instead of taking prescription medication that we have to write.
Yes, cool.
Yeah, well, yes, okay. So I prefer the natural way. So this is what I learned for the outside. When you had a pain attack, when the inflammation happened, we can use a product from Pharmanex New Skin called Flex Cream, and it's spelled FLEXCREME, Flex Cream. So it contains menthol and many things, many other things. We don't talk about product here, but that's the name. And you use that for the outside, and you massage it, and it's awesome because I use that on myself before when I do workout like taekwondo for my knee. So I love the product. So that's for outside. Now for inside, to fight the inflammation, we have an awesome product that proven work repeatedly clinically, and it's called Elocute. Elocute has anti-inflammation property with all the things in there. And according to the Dr. Joseph Mercola and all the research that I read here, that if you can, beside this product, you can eat a lot of cherry and blueberry and strawberry. Okay, all the berry will help to why we want those, because it has a focus on the anthocyanin and the bioflavonoid. That is the two group of antioxidants in the fruit that will help to fight with the with the inflammation. And we anthocyanin and bioflavonoid also help in this Elocute, and also in the Lipac Nano that I have here. So this is the packet of the Lipac Nano. So these two have bioflavonoid and anthocyanin in here. So that's why it helps with anti-inflammation, especially this one, anti-inflammation, big time. So that's why we use this one. And because the reason is anthocyanin and bioflavonoid slow down the enzyme called cyclohexogenase 1 and 2, and therefore it's reduce and slow down and even prevent the inflammation from the gout, or from the uric acid crystal inside your body. So those are the fruit you can eat to help, and these are the supplements, okay, anti-inflammation. But also, according to one of the literature that I read from the Johns Hopkins Medical School, probio also clean out your gut and help out to put out your, delete the uric acid inside your intestinal system more effectively. So if you keep your gut clean and your gut healthy by using the probio, it helps to get rid of the uric acid that inside your intestinal system, and therefore it has no chance to go back into your blood and create problems, right? So that's another one. Keep your gut clean by using the probio. But also during the last 5 years that I worked with New Skin, I know these products, R-Square. Okay, this is R-Square Day and this is R-Square Night. So this one R-Square Night has grapeseed and red, orange, and a lot of other stuff that loaded with antioxidant. So it's anti-inflammation and it's cellular purification. So therefore, it's very effective in clean out your blood, help to clean your blood from the uric acid. Yeah. So, and also this one it's called R-Square Day, and it has ginseng, cordyceps, and pomegranate. And with the combination of these three ingredients, it helps to reduce the pain during the inflammation. Inflammatory attack of the gout. So this one to help to reduce the inflammation and help to reduce the pain for you. And this one clean out your blood by the cellular purification aspect of it. So these are the products that I have been used on our client, and it works. So just want to share it here with you.
Okay, so as you can see, these are the supplements that you can take to not only from the inside, but from the outside as well. And obviously, these products are natural. They don't have side effects like the medications, Western medications that we take. Traditionally, it does come with a side effect. There are many other things that you can do to prevent or to help. For example, we already mentioned the need to lose weight. That's number one. Hydrate yourself. The more you drink water, the better, because you will excrete out, get rid of this uric acid in your system. And so the more you do it, the better that will be. In terms of stay away from fructose, especially the corn syrup. I know it's very difficult, but whatever you do, whatever you take, make sure that it's in a moderate amount, so that your kidney can be able to excrete out all this uric acid. Things like that. And most important for guys we may not know is that drinking beer. Alcohol is number one, okay? And especially when you drink while you're eating your steak, the red meat, you can't do it. A lot of people who love to go out and eat at the restaurant with shellfish, crabs, and things like that, all have an increased risk of gout attack. And so
a good supplement to help, in addition, the fruits, the best fruits to eat are cherry, as cherry. Well as the berry. Mixed berry help. Also, apple cider vinegar help as well too. Right. Helps people to lose weight, helps to lower cholesterol, also help gout attack as well.
That's right.
So I guess we're running out of time.
We are over the time, but we would like to thank you for following our show. Especially a special thank to our special guest, our scientist Hannah Tran, who I know she's very busy, but willing to come up here in our show to share some information so that you can learn a little bit and make a lifestyle change a little bit, so that you don't have this risk of having gout. And as you know, the gout is getting more and more, and so we need to be very careful. Our scientist Hannah Tran, would you like to say last few words for the audience?
Yes, please remember that even your parent might have gout. but you don't have to
Genetic.
go have gout like them. You don't have to suffer the way they suffer. Just change the way you eat, watch what you eat, and exercise, and use the supplement if you happen to have high uric acid. So that's very easy to deal with. But if you don't control it, it can damage your body permanently, just like Dr. Tu and Dr. Teneese said it. So.
And so again, thank you, our scientist, Hannah Tran.
No.
And again, thank you very much for following our show. Our time is up, so we wish you guys a very good night and very good weekend. Hopefully next week we'll find a new topic to talk about. So hopefully you can learn something. Hopefully that will change your lifestyle a little bit so that you can live a longer, healthy life. Right?
If anyone has any questions, don't hesitate to contact our scientist, Hannah Tran, or contact us or anyone who invite you in so that we could try our best to answer you during our next session. Again, thank you and good night.
Okay, thank you very much. Thank you, Go.
Yeah,
Yes.
Proactive prevention is better than reactive intervention.
There
That's
you go.
right,
there
Go.
you go. Thank you,
Thank
Go.
you, Go.
Yes, very good. Good night.
Thank you. Bye-bye.
Bye. Thanks.